Professor, the figures really are quite shocking. What is the US getting wrong in preventing the spread of COVID-19?
Well, they had things wrong from the beginning, starting with the lack of testing throughout the United States. So they didn't accept the WHO testing, and so they were basically almost 2 months before they had the number of tests they needed. And even now, there's lack of testing in many jurisdictions in the United States.
Well, President Donald Trump says America does not need and will never have mass coronavirus testing. And in fact, the federal government ends funding for coronavirus testing sites today. Is this a big mistake in your view?
Well, most of the testing is done at the state and local level. But the Federal Emergency Management Agency, FEMA, was sponsoring about 40 community testing sites in the United States, and they said they were withdrawing funding for those, turning them over essentially to the states and local governments today. They've since had to flip-flop on that because of backlash towards it. I mean, some of the places where there's real outbreaks, in, for example, Philadelphia, they were going to have to close sites because of this. So again, it's the U.S. federal government going back and forth, just depending on, the which way the wind's blowing, essentially.
Would you agree that the virus may have peaked in some U.S. hotspots?
Well, they're talking about a peak in New York City. So the deaths may not have peaked yet, but certainly when you're looking at the number of people who are hospitalized, when it was at its worst, 1,000 people were coming into hospital, if that's even imaginable, 1,000 people coming into hospital every day in New York City. And that's down to 200 now per day. So, it takes longer for there to be a change in the number of deaths, but that's very promising for New York City. So we think the peak there is going to happen relatively soon, or may have already happened. But remember, I mean, that's just the peak of the first wave. So if things get relaxed in terms of physical distancing, there could be another wave down the road. This is all dependent on people staying at home.
And of course, we're seeing other hotspots emerge as well. Some researchers say the outbreak in New York originated in Europe and not Asia. Do you think that's likely?
Well, some researchers in New York have looked at, small changes in the virus that occur, so genetic mutations. And so they kind of trace back, do some forensic science to see where the viruses came from. New York is a very international city. It looks like most of the outbreak came from Europe and the UK. But not all of it. So some came from the West Coast states, and some came from China. It's an international city, and basically just the outbreak got out of control because of the lack of testing. It was just increasing under people's noses. And so until it really became a huge problem for the hospitals, people didn't recognize it.
And the White House at first predicted 100,000 to 240,000 deaths. Now it's been revised down to 60,000. What's the most realistic estimate based on the information that we have now?
Well, models predict, and they're based on the best data that we have, so they're always updating. And it seems that social distancing, physical distancing, has been more effective than the models initially thought they were going to be. And part of that is that, if it wasn't effective, then you have individual hospitals getting overwhelmed by the number of cases, and then people who could have survived the illness end up not surviving because they don't have adequate medical care. So it seems that that's better, that people are coping better than expected, and so the mortality has decreased, the expected mortality. Although it's still an extremely shocking number and could have been much lower if there had been effective means of testing and quarantining of individuals at the beginning of this outbreak. It all depends on whether physical distancing continues. If people start to relax the physical distancing, then suddenly there could be more outbreaks, and the second wave of COVID-19 could be as bad as the first.
There's been a lot of debate in America, particularly at the start of the outbreak, about whether coronavirus is more lethal than the flu. What's your assessment of that?
Well, I don't think there's really any debate amongst scientists. It's about 10 times as lethal as a seasonal flu. And if you need to see that in action, 100 doctors have died in Italy taking care of patients with COVID-19. That's not something you ever hear of with seasonal flu. This is a much deadlier virus than the flu.
And this is an important question coming from a scientific point of view. How vital is antibody testing, and what practical applications could that have in the treatment of the disease?
Well, I think that you can have very mild illness with COVID-19, and you can even be without any symptoms with COVID-19. So as we kind of try and get out of or emerge from the very tight physical distancing we have, in places where there's been a big outbreak like New York City, it's probably going to be very important to understand who's had it and who's at least temporarily immune from it. So that's why antibody testing will be useful. Now, we don't have enough information about COVID-19 to know how long people are immune from it. It may be like the seasonal cold where, it doesn't last beyond a year, or like SARS where, you seem to have prolonged immunity. So there's a lot to be determined, but, it will be useful in terms of right now understanding who's had it and who hasn't. There definitely are some studies ongoing and some very promising results looking at patients who are quite ill who receive blood or plasma from people who've recovered from COVID-19, actually it being very helpful to people and people potentially surviving COVID-19 because they've received the plasma of people who've had it, so transferring the antibodies. This is under study, but it's very promising. Now, in places like Australia, where fortunately the outbreak hasn't been anywhere near as severe, there may be many fewer people who actually have immunity because many fewer people have actually had the disease.